Hi, I'm Dr. Wendy Wagner, and I'd like to do a brief overview of NSTs, or non-stress tests. Basically, this is something that normally gets done at the end of pregnancy, usually gets done at the end of pregnancy, for issues such as decreased fetal movement, high blood pressure, diabetes, etc. It's a test that looks at the health of the baby in utero, and I'll just give a general overview of how it's set up and what it looks like and what the meaning of the results are. This is the Nsp machine. It's off right now, but let's see, we can turn it on. There are two of these transducers that get attached. One is the TOCO, and this is what measures the contractions and the activity of the uterus. The other one is an ultrasound, very similar to the Doppler, and this is what measures the baby's heart rate. So when you get the non-stress test, you lie down here. There are two belts that go around. One gets the heart rate of the baby on your belly. The other one is up higher and checks the activity of the uterus. Usually stay on here for about 20 to 30 minutes, depending on what we call the reactivity of the baby. When you look at the screen, the baby's heart rate will be up top and the uterine activity will be below. And right now I'll show you some strips that we get, some results from the non-stress test. So the result from the what we call the strip, or the non-stress test, is the baby's heart rate above and the uterine activity below. So the top part, what we're looking for is not a flat line. So we're looking at what we call reactivity. Basically that the baby's heart rate is having some rises like this, and we actually measure those rises, and they need to meet certain criteria in order for the strip to be reactive, meaning the baby is healthy and can, withstand some stress. The bottom of the strip, this is the baseline, so when the uterus is relaxed, and when you get a contraction, it goes like this. Now, interestingly, you may look at this and say, well, this contraction is stronger than this contraction. However, the TOCO, or the piece of the non-stress test that is measuring the uterine activity, is not measuring the exact strength, it's just measuring when the contractions are. So in other words, if the belt was tighter and the TOCO was pressed closer to the belly, these would look higher. So it doesn't actually measure the strength, it just measures the timing of the contractions. So in general, if you are getting a non-stress test, you're going to be put on the machine, and your physician or midwife is going to take a look and make sure that you have a reactive strip and you're not having regular contractions. Depending on why you're getting monitored or how you're getting monitored, these non-stress tests may be part of what we call bi-weekly fetal surveillance, which means one non-stress test and one biophysical, which we'll talk about later. It's an ultrasound. So you'll get 2 times a week, you'll get one strip and one ultrasound, and that's how we will monitor how your baby is doing.